Well, maybe they were in a serious car accident, even suffering from a gunshot wound. There are many reasons why every day patients with trauma find themselves in danger of severe blood loss. And in hoping to improve their odds, their outcomes, Mount Carmel Health System is taking part in the Cavalier Study. This is a national effort. So here to share more on the goals, the impact on trauma care, we have Dr. Spalding, a trauma surgeon with Mount Carmel. So good to meet you.
Thanks, nice to meet you too.
All right, let's start with the name, Cavalier, right?
Yes.
It does actually stand for something in this case. Tell us what it is and why that is significant to this study.
So it stands for calcium and vasopressin in emergency response. So it's significant because these are medications that I use quite frequently, but we're trying to go through and push these medications to patients early in their traumatic experience and when they're bleeding. And so the point of the study is to go through and ask that question: if we provide care early, is it going to go through and change outcomes and improve those things? And so these two particular medications are often used, they're pretty common, but they do have a significant impact when we use them in the hospital. So we're trying to push those out to the field.
And I know obviously we are not medical professionals, but
Yes.
Can you tell us kind of the basis of these medications specifically, what they do when you are faced with trauma?
So calcium is something that we have in our body all the time. It's with our neurologic system, our cardiac system, and specifically for this study, it helps us to form a blood clot. So when we do get injured and we're bleeding, we lose blood, we have a hard time forming a blood clot. Our body is doing everything it can to try to form that blood clot. And then when you come in, hopefully not you, but when you come in to me, I give you blood. The way we store blood in our country, it also eats up calcium when I give it to you. So all of our trauma patients who are bleeding are depleted in calcium. So when we do that and we give them calcium early, the hypothesis is that we can go through and allow them to form a blood clot significantly earlier than they would in the hospital. And our EMS providers are going to go through and be doing that almost on scene.
Okay.
So as the point of injury versus waiting until you've lost a lot of blood. Vasopressin is, it's a category of medications called vasopressors, and it allows us to kind of tighten our blood vessels. It increases our heart contractility, so we get a better pump. And so it's going to provide that better blood flow to like your heart, your brain, your lungs, these things that are vitally important for our survival, to try to hopefully have better outcomes when we give that to you in a systematic and an early way.
And I will say, just looking into this study and kind of what was involved as I was getting prepared for this, the first question I had is, well, how do you get people to sign up, right?
Yeah.
I mean, nobody knows they're going to be in that situation. It's a trauma-based thing. So when you're talking about this research, this specific type, how does that differ from the other research projects that you get people to sign up for, right? They kind of know what they're doing ahead of time.
Trauma and emergency research is very tricky. It's very specific. And when you're injured, I typically can't stop everything.
Sure.
And say, hey, this is the study, would you like to sign up for that? Cancer trials, we do that a lot. But when we're in emergency response trials like this, we have to go through and get an exemption from informed consent, because we have to go through and do this trial and do these medications quickly. We don't typically have time to call your family member to do this. So as the FDA goes through and looks at these trials, if they meet criteria, then this is kind of part of the reason why we're talking today, is to inform the community about the trial. And so we can go through and say, this is what the trial is, so we can have an exemption from informed consent, start that. And then once you're better and improved, we would tell you that you're a part of the trial.
And I think when you're talking about this too, these are drugs you already use on these patients.
Correct.
It is just at an earlier time, right? And that's kind of the crux of this, is to seeing if earlier is better. It cannot be any different than if you got it at the hospital as far
Correct.
as what the treatment plan is, right?
That's right, yep.
Okay.
And it also does something very unique within this. The LIGHTS network is the group that's putting on the trial. It's a big DoD funded group. And the real question becomes, can EMS providers assist the care of trauma patients early? This is one of the first trials that really starts to focus on providing specific medications by our EMS. So we're partnering with our local EMS, with Columbus Fire, to say, can you go through and help provide the same care that we would be doing in the hospital, but now you're going to be doing it on the scene. So it really advances that trauma care to those patients when they're getting injured.
And a national effort, as I mentioned, so this is a big deal. It's something that you guys want to be on the forefront of. What does it mean for Mount Carmel to be involved?
This is really pivotal for us. We've been growing our trauma program for a long time. On the east side, we have a patient population that we care for our community. We're very proud of it. And as we're growing with this is one of these pivotal things that we can not only provide the advanced care for our patients, but we can start to answer those questions that could potentially impact the care that we provide for trauma patients nationally and even globally.
Even globally. So what stage of the trial are you in? How long does this last, so folks know?
So we're in the early phases of the trial. It's currently enrolling in Pittsburgh. They're the only site that they're the founding kind of member, and so they're currently enrolling patients. But here in Central Ohio, we're still in the approval process. This is part of that approval process, is to let the community know that this trial is ongoing. The trial will be several years, so it'll probably be 5 to 7 years. We'll be having press releases about the data. We'll be doing publications and presentations on how the data is forming out as it goes. So hopefully we'll be able to have more conversations about this when the trial is complete and ongoing.
Yeah, definitely. And I've no doubt this could be huge, has the potential to be huge for patient outcomes.
Absolutely.
So this is incredible. I want to send people to lightsnetwork.org, as you mentioned. They are the ones putting forth this study, /Cavalier. That's the name of it, obviously. So you can read about it, learn more, and obviously be prepared if something traumatic were to happen in your neighborhood to you. You'd know what was going on. So thank you so much, Doctor.
Thank you very much. I appreciate it.